Public-private partnerships, PPPs or P3s, are playing an increasingly important role in the development of social infrastructure in the Middle East. As governments seek to address the region's growing infrastructure needs, PPPs offer a flexible and innovative way to finance, design, build, operate, and maintain vital infrastructure assets. From hospitals and schools to transport, water, and sewage systems, PPPs are being used to deliver critical assets across the Middle East. So my name is Andrew Thomas. I'm the Advisory Director at WSP in the Middle East. And in this episode of the WSP Anticipate podcast, I'm pleased to be joined by Nasser Mahmoud, founder and CEO of Concept Realisation. In today's episode, we will discuss the challenges facing PPPs in the region and the massive opportunities they offer in delivering efficient social infrastructure. Good day, Nasser. Welcome to the WSP Anticipate podcast. It'd be great to kick off the episode by hearing a bit about your background and your career.
Thank you, Andy. It's really a pleasure to be on this podcast. So I refer to myself as a PPP strategist and transactions practitioner. I run a niche consultancy firm called Concept Realisation, and our mission is to help clients formulate credible and sustainable win-win strategies and transactions in public-private partnerships. Our focus is on what we call the social sector, which covers healthcare, education, social housing, and public amenities. In a way, Andy, I kind of feel that it's somehow my destiny to end up in this field. I went through my career picking up various qualifications and experiences, and then found myself with a base that actually allows me to really deliver value across all of them. So like yourself, I'm a civil engineer, chartered civil engineer. I went through all of that training. I did a master's in economics and management, and then I studied law. I'm a fellow of the Chartered Institute of Arbitrators. And I also did a master's in finance at London Business School, specializing in project finance. And of course, as you know, to really lead and understand PPPs, you have to have a good understanding of all these disciplines. And I've been in the field for the last 28 years. I remember the date because it coincides with when my second son, Ziad, was born. Literally just after his birth, we were appointed. I was with Coopers and Lybrand to lead and advise them on the prison contracts, Bridgend and Fazakerley, which were the first PPPs to actually be signed by the UK government.
Nasser, thank you for that. So when governments are considering, for example, a social PPP, what are the main types of PPP that they can consider?
That's a good question, and it kind of often comes up when we're structuring PPPs. So in a way, you can think of PPP as a spectrum between pure services and pure infrastructure. And of course, there are different ways in which the PPPs are structured in terms of the risk that is allocated to the private partner. But I like to categorize them in three broad categories. The infrastructure PPPs, which I think are most common, and in a way, I think more than 95% of PPPs done in the UK, for example, were infrastructure. And that's similar to, for example, the project that you and I met on, the Saudi second wave PPP schools, 60 schools, all done on an infrastructure basis. So, of course, that's doing the building, the design and build, the financing of it, and providing maintenance and other facilities management, but not doing the core services. So not doing the pedagogical services in that case. Or Al Ansar Hospital in Saudi also, which is an infrastructure PPP where the clinical services are not delivered. Within that, there are also the equipment-based PPPs. And this is where the likes of GE and Siemens and so on come into it. And this is about providing equipment. I mentioned those in the context of healthcare, but of course, there are equipment PPPs across a whole spectrum from trains and controls and so on. And that's where, again, the provider can come in and provide only the equipment, maybe the piece of infrastructure that houses that. But within that, they will deliver either just the maintenance of the equipment or provide the service. And the third category is it's often called integrated PPPs. I like to call them service-based PPPs because the core thing about those PPPs is actually delivering the service. And we see those usually with the infrastructure being provided.
Great. Okay, so three main types of PPPs then. So maybe we can have a look then. What are the sort of pros and cons, the strengths and weaknesses of the three different types? Putting aside the percentages and so on, just what are the strengths of each type? What is the best type of PPP that government should consider when they're looking at a social infrastructure project?
I mean, I think to kind of weigh up pros and cons, I think in the first place we should look at the objective that the government is looking to achieve in configuring a PPP. And I go back to one of the catchphrases that were being said when you and I started on PPPs many years ago in the UK. When the task force used to say PFI, because that was the term then for public-private partnerships, the Private Finance Initiative. It used to say private finance initiative is not about finance, it's about management. And that kind of really strikes home because when a PPP is being done just for the sake of getting funding, it's usually addressing the wrong objective. The objective really needs to be about bringing private sector expertise. And I think then we can understand the pros and cons in terms of why governments would want to bring those on board. So, if we look at an infrastructure PPP, for example, I think where the government has the competence and the readiness to deliver the service itself, whether it's the teaching in the classrooms or the healthcare service within the hospital, but requires infrastructure that is reliable, that can be done promptly, and that remains up to date in terms of its technologies and so on, then that would be a good. So that's a pro for doing an infrastructure PPP. I think that the drawback with infrastructure PPPs, because many governments think that that's actually an easy way out, that you just do the infrastructure PPP. I think sometimes getting the right capacity and having the future proofing built into the contract can be a challenge. And I would say that's in particular relevant to technology driven projects, and healthcare is clearly more and more technology driven. And even education, I mean, we're seeing much more technology coming into the classroom and even outside of the classroom. So by locking itself in for a period of 20 or 25 or even 30 years in a contract that has little flexibility can actually be a drawback or a con. With a similar thing in a way applies to equipment-based PPPs. With service-based PPPs, that would typically be done where the government is looking for support in delivering the services themselves. So really looking at a provider that come in and design, build, but also staff, as well as equip, of course, staff and operate the clinical services or the teaching services and so on within that kind of facility. Now, the driver to that should really be bringing in the private sector expertise, whether that's efficiency, improved outcomes. That should be the key driver. The con there would be that if the project is not configured in a way that's going to draw that additional efficiency or that improvement, then you're really defeating the object of bringing in the private partner. So an example of that would be if you bring in the private partner and constrain them in all sorts of ways in how they deliver the service to bring it to life. If you say that you must, and the payment mechanism, for example, is that if somebody is admitted for a knee surgery, they have to have a length of stay of 5 days, a minimum of 5 days. Well, you're kind of not getting the efficiency gain if a provider can do a knee replacement with a turnaround length of stay of 3 days, for example. So it needs to, the whole configuration of the service-based PPP needs to be done with that in mind, so that you are bringing in the efficiency, the innovation, and so on from the private partners.
Good, thank you. So look, concept realization and WSP are now, we're in the same market out there. receiving large numbers of inquiries. I know that you sort of prefer the social sector PPPs, but how do they compare? If you're comparing, maybe you receive two tenders on the same day and you're trying to look at one and look at the other. How does a social sector PPP compare to like a transportation or energy PPP? And maybe you can illustrate the differences with an example or a couple of examples, Nasser.
Sure, sure. Yes, I mean, I took a decision some years back that I particularly want to focus on the social sector. I just find it very intellectually challenging, and one of my objectives in life is kind of to add value to people's lives. So, I see it done more in that way. Of course, roads also add value to people's lives, but social sector PPPs are quite sensitive because they touch people where it really matters. Of course, roads also do, but you can always get from A to B even with a bad road. But it's very difficult to get cured if you don't have decent healthcare. It's very difficult for a nation to improve its level of education if you don't have decent schools. Um, the One of the key differences, I think, in the social sector is the expectations of people. So people actually expect that the government will provide services and that the government will actually pay for the services, whether that's health or education or social housing. Um, they may be expecting not to pay for it in an indirect way, meaning through the national health insurance contributions or certain taxations and so on. But they don't expect to pay school fees at a public school. They don't expect to pay consultation fees and diagnostic fees and surgical fees when they go to a public hospital. And I think this is where kind of some of the mismatches come up in terms of people's expectations and why we kind of would need to address those, because in that sense, we find that especially social sector PPPs get quite misunderstood and they're compared to privatizations. And we can talk later about some of the strategies for overcoming that.
You've kind of hinted already, I think, at the answer to this one, but how do we assess the success of a service-based PPP?
I think being a service, the key measure would have to be outcomes. Um, but of course, outcomes are always difficult to define. And if we're looking at outcomes as a way to, in a PPP contract framework, penalize the provider if they don't meet those outcomes, then we have to be quite careful in how we devise these. We're in the process of compiling KPIs, for example, on a couple of our projects, and coming up with KPIs where the provider is entirely in control can be quite problematic. So let's take dialysis as an example. One of my projects is monitoring a dialysis PPP contract in Central Asia, and with dialysis, you can set out certain parameters for the state of health of a patient who is receiving hemodialysis treatments. But if that patient is not observing dietary and lifestyle and exercise requirements, then the blood tests and so on are just not going to be conformant to the KPIs. And I think this is where the configuration of these KPIs really has to be done with a lot of care and sensitivity. So yes, I mean, I would say throughout outcomes. And another key dimension is what we call generically as customer satisfaction. So in the case of healthcare, it's patient satisfaction. In the case of education, it's the students and the pupils or students and their parents, essentially the key stakeholders within a child's education, how satisfied they are with the whole process that takes place there.
It certainly feels as if there are quite a lot of challenges that we face as professionals trying to advise in the PPP social infrastructure space. When we're talking about schools and outcomes for children and outcomes for patients in a hospital, there are so many factors that impact the result and impact on those KPIs. But how would you summarize some of the biggest challenges that you face on a day-to-day basis with your business?
Yeah. Um, I think the first thing that comes to mind is how to evaluate demand, because data is always complex. It's complex to find, complex to extract, even if you find it. Um, and sometimes it's difficult to explain why you need this amount of data to actually come up with an answer. Um, the issue there is that you are configuring a facility for a period of 10 or 20 years. And there are so many uncertainties also in terms of what will happen there. So we were talking about dialysis earlier, and we know that this is a big issue in the region. And trying to predict what the numbers might look like in 3, 4, 5 years time is a task that can be accomplished. But if you're trying to make projections for 10 or 15 years, it is complicated. And when you talk to dialysis providers, they'll tell you they're not interested in deals that are, especially if they're also building and providing the equipment, they're not interested in deals that are south of 12 years. So these are issues that governments and advisors to governments really have to face in terms of how to configure a transaction with a long time period where the prediction of where we're heading might not be so clear. And what we don't know if, for example, there could be a magic pill out there in a few years' time that might, reverse the impact of chronic kidney disease. We don't know if there is, but with all the research that's going on around the world on kidney disease, it's not inconceivable that something like that might happen. And the same with schools, for example. As you know from what we learned from the pandemic, is that it is possible to actually do remote education. It is possible to do it as a combination of the two, where the kids can get some interaction but can attend some classes remotely. That will automatically make an impact on the amount of infrastructure that one needs. We're seeing that in universities as well, public buildings in a big way. Now Dubai, for example, is talking about the metaverse and potentially having public services done through the metaverse. That will definitely reduce the need for that type of thing. So I think just predicting how much infrastructure you need into the future, particularly in a context where you're trying to configure a deal for a period of 25 or 30 years, which is the kind of optimal time in terms of amortizing the asset. So I think that they're the key areas, I would say, evaluating demand and really the future proofing and so on that you have. I think the other key one I would like to raise is to guarantee the political support throughout the time period of the project. Healthcare is a big political issue always, and I'm not being specific about any country, anywhere. And you see governments that favor the involvement of the private sector, and then governments change and they're anti the private sector, and it becomes just another thing that the provider has to face up to while they're trying to do their best at delivering clinical services.
Yeah, I think that's it's interesting. That sort of flows quite nicely into the next question, which was around that whole area of public perception. And I think you and I are both at that sort of golden age where we remember how the excitement of the early days of PFI and the kind of rather messy ending to it in the UK, where exactly as you say, what's a trend 1 year, 5, 10 years later might become something that doesn't smell good anymore. So, how big a challenge is this public perception, and what do you think? Certainly in the context of the Middle East, what can be done to kind of improve the public perception or public understanding of PPP?
If we look at, in particular, social sector PPPs as being, let's use an expression from the FMCG sector, white labeled projects. So actually, from anyone coming into a hospital or into a school, they have no idea whether this is done under a PPP or under a public sector direct provision. They they might feel a difference when they walk in there, that the school is well maintained and clean, and has technology that is more up to date and so on. They might just feel that. But the service itself and the reception there should feel the same. The other dimension, of course, is whether they suddenly have an obligation to make payments. And the UK, for example, ran a campaign at one time to say these services are free at the point of receiving the service. And that phrase actually captures a lot, because it's not saying it's free, because people are paying for it through NHS contributions and NI contributions, rather, taxations and all sorts of other schemes. They're just not paying when they go to get the particular service. And I think as long as those kind of messages are motivated, that this is a public sector facility, it's for the public patients, it's for the public students, it's a public amenity that is open to everybody. And if you pay to use a public swimming pool, which doesn't happen in the region, of course, but if you pay to use a public swimming pool, then if it's under a PPP, you're also going to pay, and you're going to pay the same amount. You might, when you walk in, find that it just offers a much nicer environment and a better service. That's all.
Yes, that's absolutely right. I mean, value for money is another challenge, isn't it? That sort of beauty's in the eye of the beholder, and proving value for money over a 30-year period, you virtually need a crystal ball. But I think, look, I'd like to say thank you to you now, Nasser, for the invaluable insights you've shared with us today and our listeners. And happy hunting as far as the future goes. I know that sometimes